Hello everyone, my name is Dr. Timile. Today we are going to look at alcohol and depression. Alcohol abuse is a pattern of drinking that interferes with day-to-day activities. It is also known as alcohol use disorder. The ICD-10 code is F10.10. F10.10 refers to alcohol abuse uncomplicated. The DSM-4 criteria for alcohol use is extensive. To summarize the DSM-4 criteria, a person is said to have an alcohol abuse problem if they start drinking a lot uncontrollably. They make several attempts to stop the alcohol but fail. The alcohol abuse is so bad that a lot of time is spent trying to get alcohol instead of working or studying. This alcohol-seeking behavior is as a result of uncontrollable craving. The situation is so bad that more and more alcohol is needed to achieve a state of drunkenness. 1 beer is not enough, 2 beers are not enough, 3 beers are not enough, and it goes on and on. An alcoholic can be involved in a serious car crash on one day while drunk, but will drink and drive the following day. That is a sign of alcohol abuse. Even more time is spent trying to recover from the effects of alcohol. This can be absenteeism due to being sick or being late from work. Serious withdrawal occurs when an alcoholic suddenly stops using alcohol. They become sick, they shake, vomit, and have headaches. They cannot sleep. They may even have seizures and die. The alcoholic has to take another drink in the morning to stop these problems. The CAGE questionnaire is a simple screening tool used to assess alcohol abuse and dependence. It consists of 4 questions, each addressing key aspects related to alcohol use behaviors. The name CAGE is derived from the first letter of each question. Cut down. Have you ever felt the need to cut down on your drinking? Annoyed? Have people annoyed you by criticizing your drinking? Guilty? Have you ever felt guilty about your drinking? Eye-opener. Have you ever had a drink first thing in the morning? An eye-opener? To steady your nerves or get rid of a hangover? The CAGE questionnaire is designed to be easy to administer and can provide a quick indication of potential alcohol-related issues. Each yes answer suggests a higher likelihood of alcohol abuse or dependence. However, the CAGE questionnaire is not a diagnostic tool on its own, but rather a screening instrument. A positive result on the CAGE should prompt further assessment by a healthcare professional trained in alcohol use disorders. So what is safe alcohol use? It's considered safe to have up to 10 standard drinks per week and no more than 4 standard drinks on any given day. Let's break down what one standard drink typically includes. It's almost equal to 1 beer, which contains 5% alcohol, or 1 glass of wine, measuring 150 milliliters, or 1 shot of spirits. So essentially, one should not drink more than 4 beers a day. Now, what is alcohol intoxication? It refers to a disturbance in behavior caused by excessive alcohol consumption, also known as drunkenness. Symptoms of intoxication include slurred speech, poor coordination, and changes in behavior. What is alcohol poisoning? It's a deadly and serious consequence of drinking large amounts of alcohol in a short period. It results in 1. Loss of consciousness, 2. Vomiting, 3. Seizures, 4. Poor breathing, and 5. A slow heart rate. Does alcohol damage the brain? Yes, alcohol can indeed damage the brain, particularly when consumed in excessive amounts over a prolonged period. Alcohol kills brain cells and causes the brain to shrink. What are the signs of alcohol withdrawal? Alcohol withdrawal signs and symptoms can vary in severity depending on the individual's level of alcohol dependence and health status. They typically occur when someone who regularly drinks heavily suddenly stops or significantly reduces their alcohol intake. Here are the common signs. 1. Tremors or trembling hands, especially noticeable in the morning. 2. Sweating or increased perspiration even without physical exertion. 3. Nausea and vomiting, which involves stomach discomfort and sometimes vomiting. 4. Headache, a dull or throbbing pain in the head. 5. Insomnia, which is difficulty falling asleep or staying asleep. 6. Anxiety, feeling nervous, tense, or on edge. 7. Mood swings, including irritability, moodiness, or emotional volatility. 8. Increased heart rate, with palpitations or feeling like your heart is racing. 9. Severe confusion, which includes disorientation and difficulty thinking clearly. 10. Hallucinations, seeing or hearing things that aren't there, often visual. 11. Severe agitation, which involves restlessness, irritability, and extreme emotional disturbance. 12. fever or elevated body temperature, and 13. Seizures, which are convulsions or uncontrollable shaking. Does alcohol cause depression? Yes, it does. Alcohol can cause depressive symptoms. Furthermore, alcohol makes depression worse and interferes with antidepressants. Treatment should not be taken with alcohol. Additionally, treatment should not be stopped to drink alcohol. As we know, alcohol makes depression worse. Let's discuss treating alcohol and depression. In a 2020 meta-analysis comparing 66 randomized controlled trials across 18 categories of medication, with 5,890 participants exploring alcohol use disorders and depression, the outcomes were as follows. For remission of an alcohol use disorder, disulfiram, also known as Antabuse, was the most effective at reducing alcohol use. Anticonvulsants, including carbamazepine, topiramate, and tiagabine, were also shown to be effective. Additionally, the combination of naltrexone with an SSRI proved to be effective as well. Thank you all for your attention during our discussion on alcohol and depression. To wrap up today's session, we're going to have a quick quiz to see how much you've learned. This is a chance to test your knowledge and reinforce some of the key concepts we've covered.